Today, we are reporting 1,104 cases of COVID-19 in our community, an increase of 38 cases from yesterday. All cases are workers in the agri-farm sector. 656 cases have resolved. 3 people are in the hospital. 20% of our total cases are between the ages of 20 and 29 years. 19% are between the ages of 30 and 39 years, and 16% of our cases are between the ages of 40 and 49. 52% are male, and 47% are female, and 1% is unknown at this time. Our community has lost a total of 67 people to COVID. 49 deaths have occurred among residents in long-term care and retirement homes. There is currently 1 long-term care home experiencing a COVID-19 outbreak. Windsor-Essex has 2 COVID-19 assessment centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital Olette Campus. SOHAC, the Southwest Ontario Aboriginal Health Access Centre in Windsor, also offers testing for First Nations, Métis, and Inuit people and their families. Our next Facebook Live session will be on Friday, June 12th. Starting next week, the Health Unit will be moving to the weekly Facebook Live COVID-19 updates on Fridays only. These new weekly live broadcasts will continue to include our weekly Epi Summary provided by Dr. Ahmed. Critical information will continue to be shared with the community through the media, social media, and for those who subscribe to receive emails from our Health Unit. We will continue to post our numbers related to COVID-19 on our website on a daily basis. Please continue to visit our website at WECHU.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning, everyone, and thank you for joining us again. The Ontario Public Health Standards outline the minimum expectations and requirements for public health unit, services, and operation across the province. The standards include guidance documents and protocols on all requirements under the Ontario Public Health Standards. Included in these protocols are requirements for public disclosure related to routine infection prevention and control inspections, infection prevention and control labs investigation, and infectious disease outbreak in long-term care home and retirement homes. With the gradual reopening of more businesses and workplace on the horizon, the Windsor-Essex County Health Unit will be expanding upon their public disclosures to include the reporting of COVID-19 outbreaks in any workplace in Windsor and Essex. Currently, there is no provincial outbreak definition for general workplace, as there exists for congregate settings and long-term care and retirement homes. In the absence of a required disclosure, the Windsor-Essex County Health Unit is still moving forward to declaring an outbreak for any workplace where 2 or more employees are tested positive for COVID-19 within a reasonable timeline to suspect transmission at the workplace. The role of Health Unit will continue to be the same and would not be many different other than the part of disclosure, and we will continue to investigate and manage any suspect outbreak in any of these workplaces. With more individuals going back to the workplace and increased physical contact, the risk for COVID-19 transmission increase. Research has shown that public disclosure is an important part of community education and effective measures in reducing the spread of infection. As businesses and workplaces begin to welcome people back into their facilities, they are reminded to have good infection prevention and control practices in places, including regular cleaning and disinfection, policies related to hand hygiene and respiratory etiquette, screening for COVID-19 related symptoms and illness among employee and visitors. Sick days policies to ensure ill workers are supported to stay home. Policies and practices that support physical distancing. Policies related to personal protective equipment as appropriate. All workplaces should also keep a schedule of employees and a log of visitors. This measure will assist with contact tracing and follow-up if necessary. For more guidelines and information on workplaces and COVID-19, visit the Windsor-Essex County's Health Unit dedicated webpage for workplaces. The next step in this pandemic is the reopening of the province. With many workplace reopening, residents will come into regular contact with more people on a daily basis, increasing the potential and risk for transmission of COVID-19 in our community. To stay ahead on top of this, setting criteria for declaring an outbreak in a workplace is important. Declaration of an outbreak plus into more stringent measures related to infection prevention and control, as well as oversight and monitoring, is important to mitigate some of the risk associated with COVID-19. Disclosing these outbreaks to the public are part of an important education and notification strategy that Windsor-Essex County Health Unit will continue to do for the community. Thank you.
We'll now take questions from the media. We'll start with Windsorite.
You mentioned that workplaces would now be declared outbreaks with 2 or more workers. Do you have a list of current workplaces that are under an outbreak?
The list will be updated and posted later today on our website, and we'll start to sometime this week. So I apologize. Sometime this week it will be posted, and that would show any of this list of workplaces that have 2 or more cases in that particular workplace within a reasonable timeline to suspect any transmission happening at the workplace.
Any questions from the Windsor Star?
You mentioned this sort of doesn't change anything from a public health perspective, except for the fact that this information will now be reported. Is it right to think that this is just an effort to emphasize to the public that COVID-19 is still present and we need to take it seriously?
Absolutely, and as I mentioned, that this disclosure will help the community understand better how this spread is happening, and help us also to reinforce some of those important measures that we need to take when we are visiting any of these workplaces. Because by the time if there's any transmission happens at the workplace, it's already too late. So it is all of our responsibility that when we are visiting all these workplaces, we are taking appropriate precautions to protect ourselves, and also ensuring that we are, as the employers, these businesses are doing everything that they should to prevent and mitigate some of the risk if any transmission happen in the workplace. So it will definitely help from a public standpoint. Our work, the way we investigate and we monitor and we support these workplaces will not change. We'll continue to do the work that we are doing already with many of these workplaces.
And for the agri-farm sector, a lot more testing is going on there. Are you surprised by the number of tests that are coming back positive?
Well, many of these tests that we are seeing are part of our public health investigation, and not necessarily the initiative that is led by Ontario Health and supported by all the hospital to do the mass testing in that population. So that is separate from the work of public health. Public health work is focused on the outbreak investigation and managing these cases in these workplaces. We will expect to see more cases as we expand the testing, because now we are actively looking for cases, which will definitely bring in more cases, and the impact of those cases I think will be yet to be seen. But it wouldn't be a surprise for us to find more cases with this enhanced testing.
Thank you.
Any questions from CBC?
Yes. So today, coming out and saying that you're going to start listing workplaces, isn't it a little late to start doing this? Like, why now?
I just identified some of the reasons that now there are more openings there, and I guess late in what sense? As I just mentioned, that our work has been the same, and if we identify that there is any local transmission happening within the workplace that put people at risk, we have done that, and we have done that when in workplaces that have more than or you can say unusual number of cases in those workplaces. So that has been publicly reported. What it allows more is to paint a better picture of what is happening in the community with the number of workplaces that are currently have active cases. So it's part of the disclosure process, which is not necessarily a requirement at this this stage, but we are moving forward with helping us better understand what's happening locally and also provide more information for local decision making and local action for our community.
So it's a proactive approach on the health unit's part.
That is correct, yes.
Premier Doug Ford said that he did consult with local health units when considering phase 2 of reopening for the public. Were you consulted in that process?
Well, we are in constant consultation and discussion with the ministry every day, sometimes more than once a day. It just happens all the time, and it will continue to happen. And we share all our data, we share all our information, we share all our issues that we are working locally, and that will continue to happen as we are looking for further loosening of the restrictions. The province is committed to review all that information and look at the data every week, and right now we know that we are seeing, if we call it like a third spike in our local community cases in the migrant farm or the temporary foreign workers population, and we need to get a better handle and understanding of how we can support that particular group. And there's a lot of community players working together outside of the public health, and also trying to find better solution to address them. The entire healthcare system partners are collaborating and finding innovative solutions to address this issue.
There's also calls in the public for race-based data collection when it comes to COVID-19 numbers. Is this something the health unit has been tracking?
Well, we are tracking the data as we have under the provincial databases, and there are some additional details and information that is coming down that is being collected. We know social determinants of health impacts everyone, and even based on some of the research that social determinants of health impacts disproportionately to people of certain ethnic backgrounds, certain people belonging to certain socio-demographic variables. So it is important for all of us to be looking at that data, and that data is currently being collected and will be reported as appropriate.
Thank you.
Any questions from Blackburn?
Yeah, the province announced yesterday that daycares would be reopening and that all local daycares will be working with the health unit. Can you talk a little bit about that process and working with the local daycare providers?
So I think we're still waiting for some of those details from the province, that what it looks like and what some of these guidance is coming down from. What we feel that it is important for us to have that dialogue going with the daycare operators, also with our local municipalities and also our local politicians, leadership to help us better understand the need of the community, and based on some of these guidelines that currently exist, or if there's anything else that we need to add on these guidelines for daycare workers to operate safely without putting anyone at risk. We know that there are emergency daycare centers that are currently operating, so some of the guidance is there, but we'll have to look at more broadly that how it can all be implemented for our community if that's the direction that we end up going, and what we need to do to make it safe and to reduce the risk of COVID-19 transmission in that settings.
Has there been any evidence of transmission at the emergency daycare setting?
Not at this point, but again, some of that information are still very new, and at this point, we are not aware of any transmission that's happening at these settings, and that's why we like to keep it that way, and we want to make sure that all of this processes are in place to prevent our children and the daycare transmission.
Any questions from CTV?
All right. So with the province leaving the onus on you when it comes to the decision on the child care, I'm wondering, would it be possible for you to lobby the province and say, because the barbers and the hairdressers and the gyms are saying, wow, I mean, is there an opportunity for you to say to the government, hey, look, I kind of have a handle of what's going on down here. Can we try to do that?
As I said, we do have these ongoing conversation and discussions, and we do identify some of the issues that we are seeing it locally, and those issues are communicated to the province. And unless we get a green light to say, yeah, you can make those local decisions, I think it would be very difficult for me to say what's needed and what's not needed. But having said that, I think we also need to make sure that we have all these protocols and guidance available for these places to operate safely, and we'd like to see more support from the province to see what is needed and what's not needed, and even with the regional reopening, there is this concern that. The regions that are open versus the regions that are not open, there may be an influx of people moving back and forth, and which could put more risk as well. So we'd like to review those risks very carefully and try to address it based on our local needs. And definitely, I think those conversations are happening, and we're waiting for some more guidance.
Follow up on the restaurant, on the McDonald's. So I'm wondering, like if McDonald's closing down, will you recommend businesses, like, if they get on that list, will you recommend that they close down too, like McDonald's did in Leamington?
So there are a couple of issues, and without obviously at this point, I would not name any of the business that are currently impacted or not. But without saying that, some of the things that we need to consider is, first of all, the evidence of transmission that's happening at the workplace. So that's critical, because then that would identify that if the workplace is at a risk, or someone who acquired the infection and then happens to be a worker at any of these workplaces. So for example, we have many large employers, and one large employer that everybody knows about, let's say if you have two people who are COVID positive, but they happen to be working for the same largest employer in our region, should that be an outbreak? Maybe, maybe not, because I think the key determination would be if the transmission, or if they infected one and the other at the workplace site, because then it would put the workplace at a risk, and then we need to make sure that all the appropriate measures are in place at the workplace. So in making those determinations, even for the small businesses, so we have to make that determination, and sometimes those determinations are not easy. When we're talking about the agri-farm industry, that is different, because many of these people who work at the workplace, they also share the accommodation, which makes it very difficult to make a determination if the transmission happened at the workplace or if the transmission happened at the accommodation. The evidence is more that the transmission is happening at the accommodation rather than the workplace, but in the absence of that information, I think it's very difficult to make that determination. The second aspect is when we're talking about, especially from a workplace perspective, so who's at risk and if people are at risk. And all these guidance that is currently available, if the workplace are following those guidelines, their employees shouldn't be at a risk. And even the people who are interacting with the general public shouldn't be at a risk. And then when we get notified of an individual who is working in any of these workplaces, what we like to see is what is their job duties and job responsibilities. If a job duty entails that that person is coming in contact with pretty much everyone who's coming into the store, working with all the employees, that's an easy determination to say, yeah, we don't know what the risk is, so let's just maybe err on the side of caution and then share all those details. But then there will be some occasions where you will say, no, this person never really worked with anyone. His or her job responsibility is very limited and independent. So he or she happens to be at the workplace and then also happen to be positive. And then what are some of the recommendations, which is again going back to the general recommendation that anytime we have a case, we do recommend good, strong infection prevention and control measures in place to make sure that if that person was symptomatic while at work, didn't infected or contaminated any of the work areas or anything. So that's a recommendation that we say, yeah, you need to make sure that all these places that where this employee and individual work needs to be cleaned properly, and what does it mean for the cleaning. If the employer want to go above and beyond and take extra step for maybe shutting down their business for some time, that's entirely up to them. But again, if we feel based on all of the other information that I just mentioned, that yes, there is a risk, we need to have a better handle on what is happening, because it is putting public at risk. We will be the one saying we're shutting your place down until we figure out what's happening and what are the risks to the community. And at that point, we will be disclosing and sharing that information immediately, because that will be the risk for the community. So that's kind of like a summary of the complex process that we have to go through in making some of those determinations. But as we noticed that with more businesses and the need for more information and having a better picture of what's happening in the community, so we will be disclosing some of that information that if any of the workplace with 2 or more cases of COVID, within a reasonable timeline. And obviously, as I said, there may be some difficulty in establishing if the transmission is happening or not. But if it meets the timeline, if it meets 2+ criteria, we will put that in notification out there.
Any questions from AM 800?
Yeah, do you know total how many Agrifarm workers are tested positive for COVID-19?
I haven't seen the most latest number or added it up, but roughly I can say it crossed the 200 marks in total. And with the reporting of additional cases yesterday and today, I'm sure that it is little over 200, but I don't have the exact addition done in front of me. But which would mean roughly 22% or 20 to 22% of the cases in our community.
Okay, and do you know of the agri-farm sector workers who have tested positive? Are they all migrant workers who have come to Canada to work, or are some of them people from Windsor-Essex who just happen to work at these facilities?
Most of them are temporary foreign workers that are coming to Canada, just based on their accommodation and the settings that they are in. We do not make that specific distinction about their race and ethnicity when we are managing the outbreak in particular. And some of that information we do collect, but reported later on. So at this point, I would say a majority of them, 90% or more of them, are temporary foreign workers, with some employees that are either, non-farm workers, maybe administrative staff, and also some farm workers who are from the region and happens to work in that industry. So it could be 90 and 10 split in that population.
Okay, and sorry, I think you said this, but I missed it. When it comes to reporting at all of the different workplaces, you're going to be reporting if there has been an employee with a positive case?
If there has been an employee, more than 2 employees in a workplace within a reasonable period of time to suspect transmission at the workplace, because I think that the key is everybody or most of the people have a job, and if they are COVID positive, that doesn't necessarily mean that they have acquired the infection at the workplace or have transmitted the infection at the workplace. So making those determination may not be as easy and clear cut, and in the absence of those clear guidelines on the reporting piece. So what we will be doing is, if we find 2 or more people in a workplace within a reasonable period of time to suspect that they may have come in contact or potentially infected one or the other, we will be sharing that information with the community, and that will be the part of our disclosure process from this point onwards.
Okay, thank you.
Any further questions from Windsorite?
Have there been any workplaces that have not been fully in compliance or have not taken enough responsibility? And do you think that declaring them as an outbreak, if that's the case, would help to put more of an onus on them to take responsibility for things?
Most of the workplaces that we are working with, they all have good measures in place, and obviously there's always a room for improvement in everywhere we go, and that doesn't necessarily mean that they are in violation of any of these requirements that needs to be in place. I think even as a community, we know what we need to do, but sometimes it's just human behavior. We do not follow some of those measures that is recommended to us. So I think the focus of our efforts is more on towards education rather than putting out some kind of a punitive enforcement. We want to make sure that people recognize, because unless you put that thing into everyone's behavior, it will be very impossible for anyone to police or ensure that it's happening. So we are working with many of these employers, and our experience so far has been very compliant. Many of these employers are willing to go an extra step to ensure the safety of their workers and their workplace, and that's what we expect, and that's what we want, and we'll continue to find ways to support these employers to prevent any of these cases in that population.
Any further questions from the Windsor Star?
No, thank you.
CBC?
Yes, you mentioned you'd like the workplaces to log visitors for contact tracing. Could you explain that, if I'm getting that right?
So even like, for example, every time when people are going to these workplaces, and the workplaces, I mean, I'm not talking about the grocery stores or some of the other places where it would be impossible to track and log who is coming in and who's going out. It's for the workplaces where people are going for any appointments, any businesses. And most of these workplaces already have some of those systems in place that all the visitors are asked to log in their time in and time out. And some of the other details, like who they're here to meet and what was the purpose of those meetings. So in case if a workplace is identified as having a transmission or a concern in that workplace, those logs will come in handy to be more proactively reaching out to those individuals and to provide them with more education or appropriate testing as needed. So that's the hope that everyone, if they're not doing it already, should keep a log of all the visitors and some of those details that will come in handy when there is a concern about the workplace outbreak of COVID-19.
Thank you.
Any questions from Blackburn?
Yeah, do you have any data yet regarding the random testing that happened last week? Can you say which percentage of tests have come back positive or anything to that sense?
That data is still coming. I want to say we have received, we tested close to 1,700 people in Windsor, and we received data for roughly about 1,000 people, and we're still waiting for the rest of the data to come in. And we may be able to share some partial data on Friday, but I cannot promise until we see the results. And it would be a good understanding. It will help us increase our understanding of the spread in the community, and hopefully we should be able to share some of the data on Friday.
Because, I mean, the tests in Windsor were over a week ago, right? So you're still not receiving all of those tests?
So when we are talking about the testing, it obviously and I think I mentioned that they are prioritized in a way to test the specimens that are needed more for immediate decision making that has a clinical implication. Some of these drive-through testing, when we are identifying individuals either asymptomatic or asymptomatic, it may lead to a different triage process and the priority process. But we know that the labs are providing these results, especially the positive ones, very quickly within like 24 to 48 hours. That's our experience more recently, and hopefully that will continue and will increase our understanding of the local spread.